So this is Brad. Brad is a 15 3-hands high, 8-year-old cob gelding who's currently serving as an all-rounder, with the owner having hoped to one day partake in eventing. The current owner has had Brad for 10 months, and previous to owning him, he has mainly hunted, so could still be considered fairly green. Some of the owner's main concerns are Brad's tendency to be very stressed and strong while ridden in the arena, and also considerably spooky. It often takes Brad a long time to relax and begin to use himself efficiently. As you can see from these videos, Brad appears very tense and is producing short and choppy strides. He's also reacting excessively to leg and hand aids. According to research by Monika Budzinska, 2014, the flight response is a symptom of equine stress and fear, which is something Brad displays frequently in the arena. Brad also tends to hold his head and neck in a high and alert position, which according to Zebisch et al. 2013, is another fear and stress response. When assessing the static conformation of Brad, it is clear that overall Brad is fairly in proportion. However, as displayed by the red line, he is also slightly croup high. According to Darlin et al. 1985, this can increase the tendency to work on the forehand, but that is not an issue for Brad. Although Brad is fairly fit, the high head carriage has caused him to lack muscle along the back and neck, specifically the spinalis, longissimus dorsi, rhomboideus, and the serratus ventralis thoracis. Research by Gomez Alvarez et al. 2010 discovered that a high headset causes the back to extend and therefore limits the ability to develop muscle here. When stood square, Brad tends to stand camped under behind and sometimes in front. Brad's feet are in good condition and he is able to be kept barefoot behind. His heels are quite close together, but this is an improvement from when he was first bought, so cannot be considered contracted. Although his feet look long in these photos, he was trimmed the same day. Dynamic assessment of Brad in the walk revealed that he does track up in the walk and produces the same amount of fetlock flexion in all 4 feet. The back also appears loose and supple despite being on hard ground. When viewing from behind in the walk, the right hind limb produces a movement known as medial circumduction, where the limb circles towards the midline during swing phase of the stride before being placed. According to Chopin et al. 1997, this is a common movement in horses and can be related to restrictions in the body. In the trot, Brad begins to produce shorter, choppy movements with the hind limbs, causing him to not track up from behind. However, he is happy to weight all 4 limbs and creates even flight arcs during the movement. What we know about Brad's routine is that he is regularly visited by a chiropractor every 2 months and also gets massages every 3 to 4 weeks. This is to manage any pain he previously had from ill-fitting saddles. His saddle fit is checked on a regular basis and his teeth have recently been done. His feet are in good condition and his diet is low in starch and sugar and kept simple with access to unlimited hay when he is not turned out. He is also on a multivitamin supplement and a magnesium-based calmer with added salt. This could mean that the reactions and stress that Brad seems to be in when ridden in an arena could possibly be a learned behaviour and reaction to multiple stimuli. In order to test Brad's level of stress, we took his heart rate in different areas of the yard with different stimuli. First, we took it in the stable where his heart rate was 28 beats per minute, which is below the average of about 32 to 36 beats per minute. We then went onto the yard and brought his tack into view, in which the heart rate increased to 36 beats per minute, which is still in the normal range. Once tacked up, this decreased to 32 beats per minute. We then led Brad to the arena, and once inside, the heart rate increased to 40 beats per minute at the mountain block. Here he was also very restless and fidgety. He also went for some laps in walk for 5 minutes before coming back for another test, but the heart rate maintained 40 beats per minute. We then went to the left long side of the arena where he tends to spook. Here the heart rate was 48 beats per minute, suggesting that this area is quite a daunting place for Brad and caused him to become more anxious about the environment. This is unusual considering Brad has been in the same yard for almost 9 months. When looking at the arena, it is a 20 by 40 metre arena with trees enclosing one side and a drop on the other side into some bushes. The other short sides are also closed off. It is possible, according to Momozawa 2007, that Brad could feel very isolated in this enclosed space, which is creating a stressful environment and therefore increasing anxiety. The aim of this program is to reduce the heart rate taken in the arena within 3 weeks through the use of different training methods such as introducing a new activity in the arena, in hope of making Brad less stressed in this environment. This will be done by gradually progressing exposure of ridden work in the arena over 3 weeks, while in the meantime riding in open environments. I would like to teach Brad how to target train within the stable and progress to the arena within the course of 2 weeks in order to give variation to what activities happen within the arena. This creates a positive experience. I want to take ridden work into a new environment that is more open and gradually reintroduce ridden work in the arena over the course of 3 weeks. In week 1, ridden work will be solely hacking and working in an open field, and in week 2, there will be a couple of arena sessions before returning to work in week 3. One of the first things we did was allow Brad to explore the arena on his own and encourage him to approach new things. This is called habituation. For this plan, we used information from the International Society of Equine Science, from learning theory and equitation. Habituation is one of the principles of learning. Here we encouraged Brad to approach parts of the arena that are normally issues and ignored any unwanted behaviour, and kept bringing him and taking him away from the adverse stimuli until there was no unwanted behaviour. Research by Linier and Fent 2011 showed that this was a successful way of reducing the heart rate in response to novel objects. We did this 4 days of the first week for 10-minute sessions, before or after work, and 3 days of the week for the second week, and in the third week we only did this once. Alongside this, we introduced target training. According to Slater and Diamond 2011, touch training can be used to shape appropriate truck loading and feet handling. Although this is not the aim of this case study, the research discovered it successfully reduced stress and fear responses. We began by teaching this in the stable, as we identified this using heart rate as the area he is most comfortable in. Following the guide of CRK training on YouTube, we used treats to reward Brad whenever he touched the red part of the target with his nose as a form of positive reinforcement. We then moved this onto the yard and repeated the same thing. Once he started to understand the concept, we were able to move the target further away and ask for more work to get the reward. We then moved the sessions into the arena and encouraged Brad closer to the areas he found stressful and rewarded him for this effort. This began to be something he really enjoyed over the 3 weeks. It only took Brad 2 days to understand the target training, and we managed to progress to working in the arena within 3 days of training. While we were working on new forms of training in the arena, working with the owner, we aimed to move ridden work to outside. One of the ways of doing this was increasing hacking from once a week to 2 to 3 times a week in week 1 and week 2 of the plan. Hacking allowed Brad to be in a different and more open environment with many more stimuli other than the normal arena. This encouraged Brad to show less signs of the grimace scale, such as ears, back, and tense facial muscles, as seen in research by Costa et al. 2017. This research also suggested that this could mean a changed emotional state, which in this case could be less stressed. Due to the owner wanting to continue schooling sessions, we moved these to outside in a large open field if the ground was good 3 times a week. Brad seemed to settle in this environment very quickly and began using himself properly after a couple of sessions. During these sessions, the owner and rider focused on asking for one aid at a time. According to McGreevy and McLean 2007, clear and sufficient signals along with training each aid individually are 2 of the main training principles proposed in their study, when taking into account the learning theory and the natural, ethological and learning ability of the horse. This aimed to assist Brad's hypersensitivity to aids, which could stem from too many signals. The rider focused on asking once and waiting for a response before asking again. After a few sessions, these reactions and responses seemed to become quicker. At the end of week 2, we began introducing work into the arena again, but without a rider. For this, we used long lining to replicate the aids of a rider. According to Alvarez et al. 2006, a low head and neck set can encourage the rounding of the back, specifically the thoracolumbar junction, which is an area with room for improvement with Brad. The long lining in the arena also began reintroducing him to this space and providing him with a new activity. These poles acted as a distraction from the environment and really got him thinking about the handler's aids and where he was going. During these sessions, there was no snorting or adverse movements displayed by Brad, which was a huge improvement from day one. After 3 weeks, Brad was working in the arena more efficiently and able to pass the left-hand long side that was causing problems previously without any issues. As you can see in the videos, he has begun relaxing in the work and has slightly lowered the head and appears more focused on the rider than the environment. Despite this, there is still room for improvement, as the gaits are rushed and could be more refined. However, for 3 weeks of training, I feel this was a good step in the right direction, with Brad feeling more comfortable in this environment. The owner has agreed to continue the varied work in the arena, and if the weather permits, to work outside and continue more hacking. Since Brad enjoyed the target training so much, this has also become a common exercise within his routine. If I was able to continue this training plan, I would begin desensitizing Brad to more novel objects in the arena in hand, as although he does spook, we discovered how intelligent he is and how fast he overcomes this. The training could also switch to more ridden work, working on extending the stride length and slowing the pace of the gaits. When retaking the heart rates after a 3-week training program, in the stable the heart rate was fairly consistent as expected, staying at 30 beats per minute. When in the yard and the tack is brought round, this then increased still but only to 32 beats per minute, which compared to before was 36 beats per minute. This increased to 34 beats per minute when he was tacked up, which has increased since the first time we took the heart rate. When inside the arena at the mountain block, the heart rate stayed at 36 beats per minute, which when compared to the beginning was 40 beats per minute, and when taken to the long side on the left, the heart rate did increase to 40 beats per minute. But this is still an improvement from the initial rate of 48 beats per minute. Although the improvement is only slight, combined with the improvements seen in the behaviour signs, both the owner and I are pleased with the change. Continuing work with Brad would hopefully see all of these heart rates fall into the average range. When evaluating the training methods chosen, the YouTube trainer I followed stated that clicker would be a useful method in teaching the touch training. This was not necessary for Brad, just the treat after touching was sufficient to teach him. One of the most beneficial methods, in my opinion, for improving his behavioural responses to the arena were the habituation sessions. Even though they were short, he seemed to get a lot out of them. And the owner and I have learned that in the process this is an effective way to teach Brad. The learning theory played an important role in all of the methods chosen, especially when ensuring things like safety and watching behavioural indicators. Overall, I consider this project a success, even if the results were only small. 2 weeks after this program, Brad went away to a show and managed to gain first place in 3 of his ridden classes.